Okay, Jake, I need to tell you about the most stressful afternoon of my entire year. And it did not happen at work. It did not happen at the airport. It happened at a hospital.
Huh. Oh no. Are you okay, first of all?
Yes, I am completely fine. It was not me who was sick. It was my uncle. He had a bad fall, and I had to take him to the hospital because nobody else was available that afternoon.
Oh, I see. So you were the responsible adult in the situation.
I was trying to be the responsible adult, keyword trying. So we arrived at the hospital, and the first thing I had to do was go to the reception and register my uncle.
Ha, the hospital registration process. Already stressful.
So stressful. And the receptionist asked me for the patient details, and I realized I did not know half of the things she was asking for.
Like what?
Like, she asked if my uncle had any pre-existing conditions, and I just stood there because I knew what the words meant individually, but together I was not sure what exactly she was asking.
Ah, pre-existing conditions. That is actually a very important medical phrase to know. What does it mean?
Okay, so I know now pre-existing conditions means any health problem or illness that a person already had before they came to the hospital or before they got a new health insurance policy. Like if someone already has diabetes or high blood pressure, those are pre-existing conditions.
Exactly. And this phrase is extremely important, especially when dealing with health insurance, because many insurance policies have different rules for pre-existing conditions. Some may not cover them at all or may have a waiting period before covering them.
Right. So always know your pre-existing conditions before you go to any hospital or fill any insurance form. Okay, so after registration, they told me my uncle needed to see the doctor on duty first, and then, depending on the assessment, he might need to be admitted.
Ha, admitted. That is another important hospital word.
Yes, so admitted in a hospital context means formally accepted as an inpatient who will stay in the hospital overnight or for a longer period for treatment and monitoring, not just a quick visit and go home.
Right. And the opposite of admitted is discharged, which means the doctor has decided the patient is well enough to leave the hospital and go home.
Oh, discharged, yes. I heard that word so many times that day. The nurse kept saying, once the doctor reviews the report, he will decide if your uncle can be discharged today or tomorrow.
The discharge decision is always the most anxious waiting moment in any hospital visit.
It really is. You're just sitting there praying for good news. Okay, so while we were waiting, the nurse came and said the doctor wants to run some diagnostics first. And Jake, diagnostics, what does that mean exactly?
So, diagnostics in medicine means tests and examinations done to identify or determine what is wrong with a patient. Blood tests, x-rays, scans, ECGs, all of these are diagnostic tests. The word comes from diagnosis, which means identifying the nature of a problem.
Oh, interesting. And we use diagnosis outside of hospitals too, right?
Absolutely. In everyday English, a diagnosis means identifying the root cause of any problem, not just medical ones. Like the engineer ran a diagnosis of the system to find where the error was coming from, or the consultant gave a diagnosis of a company's financial problems.
Yes, diagnosing a problem, diagnosing a system, diagnosing a situation. Same word, same idea. Find the root cause.
Exactly. And once you know the diagnosis, you can start the treatment.
Yes, treatment, another hospital word we use everywhere.
Right. Treatment in medicine means the medical care given to a patient for an illness or injury, but in everyday English, we say things like, she gave him the silent treatment, or he deserves better treatment from his employer, or the VIP treatment. Same word, different situations.
The silent treatment. I have given and received the silent treatment many times in my life. Never connected it to a hospital word before.
Now you will never forget either meaning.
Yeah, exactly. Okay, so they took my uncle for his tests, and I sat in the waiting area. And after about an hour, the doctor came out and said, "Your uncle has a minor fracture in his wrist, and we need to refer him to the orthopedic specialist."
A referral. That is another important hospital word.
Yes. So a referral in a hospital sense means when one doctor sends a patient to another specialist doctor who has more specific expertise for that particular condition, like from a general physician to an orthopedic specialist for bone issues.
And referral in everyday English means recommending someone to another person or service. Like I got this job through a referral from a friend who already worked there, or the agency works on a referral basis only.
Oh, referral in job hunting. Yes, so common. Getting a referral from someone inside the company is so much more powerful than applying cold.
Absolutely. Whether it's a medical referral or a professional referral, the concept is the same. Someone trusted is sending you to the right person.
That is such a clean connection. Okay, so the orthopedic specialist examined my uncle and said he needed a plaster cast and some prescribed medication.
Prescribed medication. What happened when you went to get the prescription filled?
Oh, the pharmacy was a whole other adventure. So the doctor gave my uncle a prescription, which is the official written document from the doctor that lists exactly which medicines the patient needs and in what dosage.
Right. And dosage is an important word to know. It means the specific amount of medicine that should be taken at one time and how frequently it should be taken.
Yes, like take 1 tablet twice a day after meals. That's the dosage instruction. And the pharmacist at the counter looked at the prescription and asked if my uncle had any allergies.
Allergies, another extremely important medical word.
Yes, an allergy is when your body has an abnormal reaction to a specific substance, like a medicine, food, or environmental element. And knowing your allergies before going to any hospital or pharmacy is absolutely critical.
Because certain medications can cause severe allergic reactions in some people, and medical staff always ask about allergies before prescribing or administering any medicine.
Exactly. And in everyday English, we say things like, "I'm allergic to drama," or "he's allergic to early mornings." Same word used to mean a strong aversion to something.
Allergic to drama is my favorite everyday use of that word, honestly.
Same. Okay, so we finally got the medicines, and my uncle was discharged with instructions for follow-up.
Follow-up. That is another important hospital phrase.
Yes, a follow-up in a hospital sense means a subsequent appointment with the doctor after the initial treatment to check on the patient's recovery and progress.
And follow-up in everyday and professional English means to check on the progress of something after the initial action. Like I need to follow up with the client about the proposal, or she followed up on her job application 3 days after submitting it.
Yes, following up is one of the most important professional skills, honestly. Whether it's with a doctor or a client, always follow up.
Absolutely. The fortune is in the follow-up. People always say that in sales, and it's completely true in medicine and in business both.
Oh, the fortune is in the follow-up. That is such a good line. Okay, before we wrap up, let's quickly go through all the hospital words we covered today.
Yes, let's do it.
Pre-existing conditions, any health problem a person already had before coming to the hospital.
Admitted, formally accepted as an inpatient who will stay in the hospital for treatment.
Discharged, the doctor has decided the patient is well enough to leave the hospital and go home.
Diagnostics, tests and examinations done to identify what is wrong with the patient.
Diagnosis, identifying the root cause of a medical problem or any problem in general.
Treatment, the medical care given to a patient, also used in everyday English for how someone is handled or dealt with.
Referral, when a doctor sends a patient to a specialist doctor, also recommending someone in a professional context.
Prescription, the official written document from a doctor listing the medicines a patient needs.
Dosage, the specific amount of medicine to be taken and how frequently it should be taken.
Allergy, an abnormal body reaction to a specific substance, Also used casually for a strong aversion to anything.
Follow-up, a subsequent check after initial treatment. Also checking on the progress of anything in professional life.
Ward, the section or room in a hospital where patients were kept and monitored during their stay.
Vital signs, the basic measurements of a patient's body functions, including blood pressure, heart rate, temperature, and breathing rate that indicate the overall health condition.
And vital in everyday English means absolutely essential or critically important. Like, it is vital that we submit this report before the deadline tomorrow.
Yes, vital, so important. Okay, everyone, that's a wrap on today's episode, Daily English Words from the Hospital. And the biggest takeaway is this: you never know when you'll need hospital English. It could be for yourself, for a family member, or for a friend. And when that moment comes, you need to understand and communicate clearly and confidently. Today, you took a big step toward that confidence.
And remember, the words you learned today go far beyond the hospital. Diagnosis, referral, treatment, follow-up. These are words that show up in offices, in businesses, and in daily conversations every single day. Learn them once, use them everywhere.
Perfectly said. Subscribe to Real Talk Podcast and share this with someone who needs to improve their English for real-life situations. Drop us a comment telling us which hospital words surprised you the most today. We read every single comment, and we love hearing from you.
Take care of yourselves, everyone. Stay healthy. Speak English confidently. See you in the next one.
Bye, everyone.